Canada was once considered by many to be a caring country, known for its public health care, its peacekeeping, progressive social policy, and commitment to human rights, not to mention the strongest bud in the world. This is not the Canada of today. Nowhere is this more evident than in the Harper government's attitude towards HIV and hepatitis C. In Canada, HIV and hepatitis C are a national healthcare crisis. Over the last 3 years, HIV has gone up by 14%. There are 3,300 new HIV infections each year in Canada. Aboriginal people, new immigrants, and people who inject drugs have disproportionately higher rates of HIV and hepatitis C. For example, Aboriginal people make up 3.8% of the overall population, but 12.5% of new HIV infections. Aboriginal women are also leading in new HIV infections, with injection drug use as the main mode of transmission. Preventing transmission of HIV from mother to baby is almost 100% preventable, but poor access to testing and treatment among Aboriginal people and people who inject drugs has resulted in more than 30 babies born with HIV since 2005. Vancouver's downtown east side has a hepatitis C prevalence of 70% and an HIV prevalence of 30%. This is an infection rate equal to Botswana. In Toronto, about 1 in 4 gay men are now living with HIV. There are approximately 250,000 people living with hepatitis C in Canada, with 10,000 new infections every year. A third of people with HIV are also co-infected with hepatitis C. Co-infected people have a higher mortality rate than people living with hepatitis C or HIV alone. Rates of hepatitis C are 7 times higher among Aboriginal people than non-Aboriginal people across the country. While HIV is on the rise in Canada, promised national funding is going down. The Harper government has defaulted on its funding promises for AIDS. And unlike many countries, Canada does not have a plan for reducing new infections of HIV and hepatitis C. Poverty and HIV go hand in hand. The employment rates for people living with HIV are estimated at 30 and 40% lower than the general population. Social assistance is often the only source of income for people living with HIV. Social assistance levels are well below the poverty line. The Harper government has done nothing to reduce poverty. Canada does not have a national poverty reduction strategy. We are the only G8 country to not have a national housing strategy. In federal prisons, the rate of hepatitis C is 45 times greater than the general population, and rate of HIV infection is 22 times greater. Among these numbers, Aboriginal people are disproportionately affected. Rates of HIV among Aboriginal women in federal prisons are 11.7%. Needle exchange programs in prisons are proven effective at reducing HIV and hepatitis C, reducing needle sharing and savings in healthcare expenditures. Canada has no such program in prisons, despite documented success in many countries around the world. Harper wants to further exacerbate these epidemics by introducing US-style mandatory minimum sentencing and other crime bill legislations. Without effective prevention programs and a growing prison population, it will only mean more new infections. We don't need more prisons. The government's own data shows that the crime rate in Canada has been declining since 1991. Despite alarming rates of new HIV and hepatitis C infections, the Harper government refuses to support harm reduction, which is evidence-based and scientifically proven to save lives and prevent new infections. Harm reduction programs have dramatic human, social, and financial benefits. Vancouver's supervised injection site prevents around 3 deaths and 35 new cases of HIV every year. This saves $6 million in healthcare costs annually. Despite these successes, it is not funded by the federal government, who continue their legal efforts to shut it down. Canada had a national drug strategy. Before Harper was in power, there were 4 pillars to this strategy: In 2007, Harper's government reintroduced the strategy as the National Anti-Drug Strategy, which has allocated $64 million to stop illegal drugs over the next 2 years. 75% of that money is directed to law enforcement, with 0% allocated to harm reduction programs. This new strategy has only 3 of the 4 pillars. Think in these tough economic times that there isn't enough money to end AIDS and hepatitis C? Government spending is down on public health, human resources, and the environment. So where does Harper want to spend all his money? People across Canada are being denied their right to health, and Harper doesn't care. Let's recommit ourselves to getting rid of AIDS and hepatitis C in Canada by committing ourselves to getting rid of a leader who refuses to address this national healthcare crisis.